Thank you so much for joining me today. I really appreciate gaining your insight on the COVID-19 crisis. So to start off, you work at the University of Miami Health System, and Miami was in the news for a while due to the spring breakers on Miami beaches. Did these events have any impact on the COVID-19 situation in Miami?
So luckily, the spring breakers that actually were on national news were not on Miami Beach. They were on beaches a little bit north of us. Miami Beach leadership and Miami-Dade County leadership actually moved rather quickly and closed the beaches before the state even had begun to think about it.
That's great to hear. Well, I'm glad that it's not having any lasting impacts on you. So, how is your institution taking precaution against the disease?
This has been a very dynamic process, and we have gone through several iterations of our plans, and things have moved rather quickly. Today, we're doing a number of things. We started by screening our visits and seeing which patients could be seen by telemedicine and which patients really needed to come to the institution. We started by screening patients for symptoms, and we're now actually testing every patient who's coming to our institutions before any new treatments. We have also cohorted our patients separately. We are lucky to have two different buildings, and our patients with COVID-19 are currently on what we call UHealth Tower, which is our main inpatient area, and patients who need standard non-COVID-19 related treatments for their cancer and still need inpatient admission are coming to our University of Miami Hospital and Clinic. So we have two separate institutions, two separate buildings where we can actually have our patients with cancer away from the patients that are being treated for COVID-19.
Well, that's great to hear. So in your practice, how are you differentiating patients from showing signs of lung cancer versus signs of COVID-19?
That's definitely one of the biggest challenges we have right now, because dry cough and pulmonary infiltrates is pretty much what we can see with lung cancer progressing as interstitial spread, or we could also have patients on immunotherapy that could have pneumonitis. Patients on tyrosine kinase inhibitors sometimes can also present with a pneumonitis-like picture. So if we do testing and it comes back positive, of course we know it's COVID-19. If testing is negative, unfortunately, because of the high rates of false negative, we still don't know for sure, so we're treating everybody as if they were infected. Anybody that has signs and symptoms that suggest that they could have COVID-19 are cohorted in a different hospital. We have specific units within that hospital where patients will be isolated and will have all precautions, not just droplets, but also respiratory. Everybody goes in with full protective gear, including coverings in the eyes, N95 masks, gowns, and so on and so forth.
Great. And how could COVID-19 impact patients with lung cancer specifically?
There's a number of potential implications and complications that we have with COVID-19. We will know more as there's a large effort in a registry study called TerraVault, being led by Leora Horn and other colleagues, and this will soon have some results that will hopefully guide us how to treat lung cancer patients specifically. We also have a larger effort for patients with cancer in general, including solid tumors and hematologic malignancies. This is the CCC19 study, for which I'm one of the members of the steering committee, and we're hoping to have some data out within this week or next, so we can also help guide what patients are at highest risk and moving forward to have actual information on how to proceed.
Oh, that's great. And how are you altering your practice and treatment for patients? Are you implementing telemedicine or phone calls?
It is a brave new world, and I'm hoping that a lot of this will continue and stay with us as we move forward. I have not been doing my usual clinic. What we have been doing now is telemedicine visits. Of course, if there's a patient that has a requirement to be seen, we will arrange, and those patients will come to our institutions. We have not delayed treatments. Our patients that are on adjuvant treatment or treatments that can make an impact in their survival in a significant way, we have continued to do those systemic treatments. Of course, we're very cognizant that patients can have complications if they develop COVID-19, so we're monitoring them very carefully.
So I know some institutions that I've spoken to have decided to delay treatment for some of their patients. What made you decide to avoid that?
Cancer doesn't stop being active because COVID-19 is here. We absolutely have to evaluate each patient's case to decide if it is safe to postpone things like CT scans for surveillance, which probably would be safe, versus stopping treatment that can make an impact for a patient's survival. So patients with lung cancer and metastatic disease progress fast, and if we miss the opportunity to actually treat the disease, patients might actually survive for just a few months rather than years, as we see in some cases now.
And are you experiencing any delays in receiving the results of those CT scans or biopsies?
We are not. So we have actually moved on to postpone surveillance scans. So if anything, it's become easier for us to do CT-guided biopsies and to actually do scans for those patients who actually need it.
That's great to hear. And so are you approaching immunotherapy differently due to the pandemic, due to increased risk?
We're definitely testing every patient, even without symptoms, for COVID-19 by RT-PCR, and we hope to soon also be able to test by IgG and IgM for COVID-19.
Great. And how is COVID-19 impacting clinical trials?
COVID-19 is having a huge impact in clinical trials. In our institution, we have stopped taking on new trials, but we have tried our best to continue those patients that are on trial so that they can actually continue to be taking the therapies that are making a difference. In particular, we're using telemedicine visits for those clinical trials for which patients get oral medications. Patients can go to one of our satellites, or we can arrange for patients to have blood tests done at home, and we do telemedicine visits so that we can continue monitoring on trial. Most sponsors have been very active and have been very helpful in accepting these as the new standard of care. So we have tried our best to keep those patients on trial. We have enrolled as well on trials that are ongoing, but we have not started any new studies.
Great, thank you. And some institutions are facing shortages of protective gear, including face masks and gowns. Are you experiencing any shortages at your institution?
Luckily, we're not. So both our county hospital and university hospital had enough stockpiles, and they have been able to secure further shipments as things move forward. Furthermore, the actual social distancing that Miami-Dade County has implemented very quickly has helped us keep the numbers relatively small.
Great, that's wonderful. And have you talked to doctors from other institutions, and how does the situation at your institution compare to others?
So yes, of course, we have stayed in touch with colleagues and friends from not just the US, but around the world. We, in the beginning, took a lot of leadership from colleagues in Italy and Spain as they were ahead of us on the curve. And we have tried to keep each other abreast of what's going on and help each other prepare as the COVID-19 pandemic is behaving in waves in different places at different times.
Fantastic. And is there any research regarding COVID-19 prevention or treatment that interests you?
Absolutely. So we are all very interested in being able to develop IgG and IgM serology tests, and we're hoping to have vaccines as well as soon as possible. So it's very encouraging that some vaccine efforts are already ongoing. And of course, in terms of treatments, there are hundreds of drugs that are being repurposed and specifically being developed for COVID-19. So we hope that in the next few months, we're going to have more options to treat our patients.
Great, that's wonderful. And how can people support healthcare professionals and patients with cancer during this pandemic?
Very simply, stay at home and continue doing the social isolation, social distancing, or rather we should be calling this physical distancing, and keep on having contact and having a social life by FaceTime, by WhatsApp, whatever app that you can actually use. So the most important thing that people can do is to stay at home.
Great. And I know it was recently announced that ASCO is planning on moving to a digital platform for the meeting. What are your thoughts on this, and how do you think that the meeting will fare compared to past years?
Being at ASCO in Chicago is kind of the highlight of our year, not just because of the scientific presentations, but also to be able to see in the real life people that we have been in touch by electronic means all year long. So of course it is a shame that we won't be able to do that this year, but this will allow us to continue doing something like that for every year, and will allow us to be able to continue getting updates in terms of scientific developments that will be important for us to treat our patients with lung cancer and other malignancies as well. I think that there will be two things that we're going to carry on from the COVID-19 pandemic experience. One of them is telemedicine. I'm hoping to be able to continue doing visits at a distance for patients who actually usually drive 2 to 3 hours to come see me. And I'm also hoping that our virtual meetings will become more interactive and we'll be able to do more meetings without actually having to be physically present. But we should continue having a number of meetings because nothing yet substitutes for actually being in the same place as those colleagues and friends that we work along all year.
Great. And is there any research that you're looking forward to seeing at the ASCO meeting this year?
Oh, there's a number of interesting things that will be coming along with immunotherapies and targeted therapies. So we are very much looking forward to seeing the virtual ASCO meeting this year.
Fantastic. Well, thank you so much for taking the time to speak with me today. I really appreciate it.
My pleasure. Please stay well.
Of course. Thank you. You too. Have a
Bye-bye.
good day.
Thank you.